Sathyabama Institute of Science and Technology.
Hello all, this is Dr. Priya Kumari, Assistant Professor, Sathyabama College of Physiotherapy, Sathyabama Institute of Science and Technology, deemed to be university. Today in this episode of Physio Beats, we are going to discuss about a very important topic, that is relevance of research in emerging trends of physiotherapy. And to share his knowledge and experience, we have a highly experienced person with us, Dr. P. Senthil Selvam, who is HOD Professor of Wales School of Physiotherapy. And sir is having experience of guiding nearly more than 11 PhD scholars. He is a very experienced person in the field of physiotherapy. We welcome you, sir. And it's our privilege to have you with us to share your knowledge and experience about the relevance of research in the emerging trends in physiotherapy. So, sir, our viewers, they would like to know what is the relevance of evidence-based practice in the emerging trends in physiotherapy. What do you feel?
Thank you so much, madam, for inviting me and giving me an opportunity to speak here in your university. With this introduction, I would like to share some of my experience, what I have gained in the past years, so that the upcoming generation could be able to grasp them and they can be more active in the research and evidence-based practice. Going back to 10 to 15 years before, our syllabus is mainly focused on the core subjects, as you know, like orthopedics, neurology, PT in ortho, PT in cardio, PT in sports, OBG, everything we had studied. And some part of basic medical sciences like anatomy, physiology, general medicine, surgery we had studied. But at that time, we don't have an opportunity to study on the subjects like orientation in physiotherapy, evidence-based practice, PT ethics and professionalism, and entrepreneurship. Research methodology and biostatistics we didn't study more, but if you take the syllabus now, there are lots of scope for the young generation to study on the topics which are very much useful for them for their clinical practice, especially the evidence-based practice as well as the research methodology and biostatistics, also like the subjects like PT in ethics and professionalism. So it will help the students to incorporate themselves and equip them to be fit enough to practice in the physiotherapy profession.
Yes.
Evidence-based practice, it is one of the important and trending one in the current generation. Especially it has been hugely followed in the European and the American countries. We are a bit lagging behind them. Maybe many reasons for that. So what is an evidence-based practice? So it integrates the research with the clinical expertise and also the patient value. So once you incorporate this clinical, the research and the patient values, especially it will give a good patient management. The patient will be very much satisfied for the treatment itself, and they will feel bit of comfort. So this has to be incorporated in the minds of the young generation. So that's why it has been placed in our syllabus. What is the very important relevancy in having this evidence-based is that it will give a good quality clinical care for the patient. So the patient at the best, they can receive a perfect treatment and they will be more comfortable with that. This is what the young generation should understand about.
Very well said, sir. Even I agree. Like if the students are focusing more on the evidence base, they will be skilled more to treat the patients, and they will have sufficient proof they have checked, and then they are applying on the patients. Sir, my next question would be like, what do you feel are the barriers in this emerging trends? Like, for the students, for the physiotherapists, emerging physiotherapists?
Yeah.
What barriers they face?
So there are a lot of barriers. So few to just list out, or maybe the cost. Maybe the cost in which they had the student or the therapist has to purchase it, and also have to maintain the new invented equipments or newly discovered ones. So that is the main barriers in which they face. Apart from that, lack of time for them. So they need to spend lot of time in having a newly
To learn the
designed to
technology.
learn the technology.
Okay.
They should spend more time and they should concentrate more on it. But nowadays it is not much to their context. So, and then they have lack in their training also. So
Yes.
they mostly believe hands-on is their primary concept in physiotherapy. So they don't know about the new technologies. They fail to understand how the machine works, what is the concept behind its working. So that they need to study a lot. The biophysics behind that treatment should be focused on. Then maybe lack of infrastructure. Very good net facility should be there. More digitalized equipment should be there. So that is one of the drawback. And then there should be some communication between the physiotherapist and ICT professional.
Correct.
So then only they can get themselves trained. So these are the main barriers which lacks in our side. Of course, there are many room for that to improvise. So they have to overcome this barrier and put themselves into a stage that they could do efficiently. So as of now, the knowledge about the evidence based and the need for the new technology is ranges between fair to good. So it should cross that good to very good stage.
Correct.
So these are the things the professionalist has to
So not
focus
only
on.
the medical knowledge, if we are
Yes.
also trained at digital
Yeah,
wise, like
yes,
if we include
exactly.
the courses like which is in a computer already,
Fine.
it's there, but little more elaborate if we have knowledge. I think
Yes.
this will help the students to be a very
Exactly.
efficient
Yeah,
physiotherapists.
yeah.
Okay, sir. And then now so many technology like AI, robotics,
Yes.
VR, so
Yes.
many has come. What do you feel is can be one which is going to change the scenario of physiotherapy profession?
As
According
in
to you?
like other profession, maybe medical or engineering or any other humanities or maybe other forms of a discipline, they are upgrading themselves by inventing and discovering some new equipments, incorporating the same to their profession. So as such, we the physiotherapist should also go into that stream. So we have to identify the needs or the demands from the patient. So we have to just go across what is the traditionally instruments are utilized now. We have to identify the needs and go into some advanced levels so that the patient may feel a better option to go for the new inventions or new innovative managements, especially AI rules a lot.
AI, okay.
AI, artificial intelligence. In physiotherapy also, AI tailors or structures the protocol. And also it is ready to give a treatment for many patients as we do one by one, but AI can create a protocol for many patient needs. So that one, and a structured protocol regime, exercise regime can be framed by an AI, and it also records the outcomes. And as per the need of the patient, it also selects the treatment protocol also and the treatment intervention also. So likewise AI and also robotics, which works according to the principle of AI, robotics, and then we have other new innovations like virtual reality, the augmented reality, and then we have motion capturing devices. where the electrodes, the sensors are placed in different parts of the body, the movement of the body is captured, and biomechanical changes or variations can be noted, and it can be shown to the patient. Video biofeedback is one of the newly emerged concepts. And then apart from that, the force platforms, the gait labs. Apart from that, we have blood flow restriction rehabilitation. So it is booming around nowadays. Rather than using a high repetitive RM for a patient, it is more difficult. So when we use this blood flow restriction rehabilitation unit, it utilizes a less power of the patient, and it gives a more output. So this is what the research says. And then we have the exoskeletal orthosis. So where the patient can wear in case of any lower limb injuries. So likewise we can.
So as you said, all these emerging trends can assist the physiotherapists definitely for a better improvement of patients. Now, so do you feel that it has to be definitely patient-centric?
Yes. So actually I started this interview like the evidence-based practice is mainly on integration of the research, the clinical expertise, and also the patient values. So patient values are taken to the utmost level, where the patient should actually get some comfortability and free from pain. So all these newly innovated techniques should assist the patient in alleviating their discomforts.
Correct. So one last question, sir. What would be the take-home message for our viewers and all the budding physiotherapists and other professional physiotherapy professionals like us?
So whatever we were discussed now, the new innovations, the need of the evidence-based practice, the documentation, the research, everything is not should not be just into the curricular level. The student should get practiced to it. So they have to be in touch with both clinical as well as the research context. So by doing so, as a therapist, we ourselves should guide them, to make them to walk in a right pathway, so that they can be able to deliver their goods. So each and every student should compulsorily learn a lot about the evidence-based, the research methods, and the PT professionalism, the ethical values. Everything should be learned by a student, so that he will be well equipped to serve for the patient's community.
Thank you, sir.
Thank you so much.
So according to sir's experience sharing, what we can conclude is the students should keep doing research, they should be guided properly, they should be doing more collaborative works and keep themselves updated, which will be of help to the patients in their improvement. So for watching such further updates in the field of physiotherapy, keep tuned to Physio Beats, the podcast for physiotherapists. Keep progressing, keep positive, and stay healthy. Thank you.